Today we are taking a procedure that is single sitting or single visit endodontics. The tooth in question is maxillary left second premolar. The local anesthetic technique which we use for maxillary region is only buccal infiltration. It is vital. It has to be going through single visit. We should not be calling patient again and again. I have already given anesthesia. Next slide, please. Next slide, please. The name of the patient is Shailesh. He is 35-year-old. As I have told you, medical history is non-contributory. The tooth in question is maxillary left second premolar, and the symptoms I have already told you. Next. So this is his pre-operative X-ray. On the X-ray, you can see the 6 has been treated in the past, and the 5 is in the question right now. Roots. It's not a very difficult case. We decided to take easier case, and especially premolar, because here it will be easier to show you all. Okay. So what we see over here is, and that is not that good, because of which they can't do good instrumentation. Access is access to success. Access cavity preparation will take you. It will give you a straight line path to the apex. So it's very important to do a good access cavity preparation. Can you increase the pressure? We all know in most of the vital cases there is some pain in the beginning. Okay, whenever we are doing a vital procedure, a vital tooth, whether it is upper or lower teeth, anesthesia, getting profound anesthesia is a big problem. So we should always think of giving local anesthesia. And after that we should be telling patient that there can be some minor pain in first couple of minutes when we are taking a drop in the pulp chamber. Okay. After that you can always do intrapulpal anesthesia. As I showed you, you almost develop a drop. You have already started giving a pressure, and you enter inside and you immediately develop pressure inside. See, I'm pressing my on the piston of the syringe, and no anesthetic solution is getting further. I'm giving a lot of pressure, but it is still not going. That simply means I could develop pressure inside. First part of the access cavity is the coronal axis, and second part of the access cavity is radicular axis, that is access to the roots. So I have prepared the coronal axis. Now I will check for the radicular axis. Endodontic explorer. It is modification of normal explorer. It is an elongated instrument, and this helps me in locating the orifices. 21 mm and 25 mm. Okay. I'm carrying some H file as well. I love to use H file, especially to remove the tissue. Okay. To the pulp tissue. Now some people have fear in using H files.
Yes, it tends to break it.
Yeah, it's basically, there is one simple funda which we need to understand about H files. H files are always used in circumferential filing motion. They are always used in filing motion, and K files are used. K files are used in filing and reaming motion. You are not supposed to rotate H files in the canal, then only they will bend. Otherwise, they are fantastic instruments to use. Okay, and then I have got some other instruments like D finder. And there are some instruments which you get at 12 number, 17 number, 22, 27, 32, 37. These are the odd sizes, the sizes in between which you get. You should always try and have them in your kitty. I have got couple of gets blade and drills which I rarely use, and I have got pluggers or spreaders which are flare spreaders which are of thicker size. We'll come to flare spreaders later when we will be doing the obturation. Okay, this is one kit which I have. Here I will be using the InGate handpiece. I will be using the InGate technology over here.
And you take it away from the camera, it's not that clear.
In some time. Okay, and there's there is one file which is white, which is a shorter file. There is one white longer file, yellow file, a red file. I will talk about what they are. Then there is blue, green and black. Okay, there are some files over here which I will show you how. Many people do a mistake that when they are exploring the canal with the first file itself, they want to reach to the apex, which I don't want to do. I will not go more than 16 millimeters. 16 millimeters is the cutting part of the K file. I will not go more than 16 millimeters. I will go inside. I will just try to check the glide path The canals are pretty wide, they are not very